I'm very concerned about the scar I have after my surgery. Do you have any strategies to help the scar?
Many patients are disappointed or surprised by the appearance of their scar after surgery. And it's important to know that scars do typically improve with time. The way your scar looks immediately after surgery or within just a couple of weeks after surgery is not necessarily going to be how it looks 3 months or 6 months or 12 months after surgery. True healing from procedure can take as long as 12 to 18 months. So I just try to encourage patients to be a little, I try to set expectations. And what I mean by that is really prepare them for, again, what I just mentioned. Scar at 3 months is going to look different than a scar at 12 months. But there are ways that you can help improve the healing. For example, there are a variety of products over the counter that your surgeon can talk to you about that may help fade the scar or improve the redness. And some of those are simply products that will, by applying them or putting them right on, is actually massaging the area so that it increases blood flow. For example, I get many questions about vitamin E oil or different types of oils like coconut oil. And what I would encourage is that you speak to your surgeon, because there are some products that can actually cause irritation or more inflammation at the site of the scar, and it may cause more redness. What I will say is one of the most important things to do is apply sunscreen to the scar or the area. Direct exposure to the sun or tanning booths will actually make the scar darker, which is what most people don't want. So it's important to wear or to have UV protection on and around the scar. Many people will take a small bandage or Band-Aid and put it right on the scar so that there isn't direct sunlight there. But there are strategies to improve redness or darkness, or sometimes the scars are firm. They have fibrosis, as we call it, or it just feels rough. And there are strategies to help minimize some of that. Keeping the scar moist is very helpful. You don't want the area to scab. The scabs can actually, if they're hit, they can be traumatized and bleed, and that can add to more scarring. So talk with your surgeon about ways in which you can help minimize some of the immediate inflammation around it. And in some cases, scar repairs are necessary or can be discussed. And often what that will mean is the most important thing is to get rid of the cancer, remove the cancer. But down the road, cosmetic repairs with a plastic surgeon or a more specialized surgeon are sometimes necessary, or could at least be considered if you're really unhappy with the appearance of your scar.